Hey, how you doing? I'm Dr. Jeremy Sutton, physical therapist with Healthy SBC. Today I'm going to show you a few exercises to do for scapular strengthening and stabilization, some rotator cuff strengthening, some elbow strengthening, things like that. I'll be using a band and a towel, which is why I'm having them in my hand. But we're going to do a couple of things to help strengthen the shoulder. This is actually for a patient I have who had a distal humeral fracture, but these are good for everybody. Try them out, let me know what you think, and leave me a comment, please. Thank you. All right, so we're gonna do internal and external shoulder rotation first. We're gonna use, I have tied a knot in this TheraBand. You may have some pulleys that you can buy on Amazon. They're super cheap. You can get a really nice set for like $10 or $15. This is just a TheraBand that you would get maybe from your physical therapist or chiropractor's office. Have a knot tied in it so that we can put it in the door, okay? So we're gonna do that first. Okay, so we got the knot in the door. We're gonna do internal rotation. So the towel, you wanna take the towel and put it under your arm and you're gonna hold it just like this. And the reason we do that is to increase blood flow to the rotator cuff to the shoulder. So this is what we call a watershed moment, where you have what's called loose pack position. So a little bit of abduction, a little bit of forward flexion is loose pack position for the shoulder, a little internal rotation too. But this just helps more blood flow to the shoulder. So we put that towel through there. It doesn't have to be this big around, but this is just what I have for now. We're gonna take the band in our hand, stand up straight, internally rotate it. So what I'm not doing is turning my body. My elbow is tucked into my towel and holding my towel firm, and it's just like I'm closing a gate. My elbow is at a 90-degree angle. So that's internal rotation. Turn here, internal rotation, okay? The next thing we're going to do is external rotation. So just turn around, keep the towel in the same place, stand upright, start on our stomach, and then externally rotate. You may want to stop at neutral, which would be exactly, right here. Can't think of the word I want to use, but anyway, neutral would be just to your arm straight, or we can go all the way out. I like to tell people just listen to your body. If it hurts to go all the way out this way, then you may want to start here or stop there, okay? Hopefully your physical therapist, chiropractor, physician, whoever will tell you where to stop if you have specific injuries. But that's external rotation, okay? Okay, so shoulder extension. I'm holding this up. You can back up to make it taller, or you can raise it up on the door to make it taller. Keep my elbow locked, and I'm pulling right down to my waist, not past my hip. So just here and here. That's shoulder extension. And then I'm gonna turn and that's shoulder adduction. I guess I could have done it this way. Here, pulling down to my hip. Shoulder adduction. The next thing I'm gonna do is kind of a tall row. We may call this a lat pull down. It's really not a lat pull down, but we're here to here. So we're rowing, just like that. So I'm starting with my arms straight, and I'm pulling and squeezing my shoulder blades. Arm straight, pulling, squeezing my shoulder blades. Sometimes if the door doesn't want to close and the knot's coming out, you just drop it over the doorknob. So sometimes that's problems. Here's a regular row. My arms start about a little under my shoulders, and then I'm pulling straight back. So here, pulling straight back. Just let your elbows come right beside you. And if I wasn't looking at the camera, I'd be looking straight ahead. I'm not looking up, I'm not looking down. Just like this, nice row. Okay. Next thing I'm gonna do is shoulder flexion and shoulder abduction. And for that, I'm gonna stand on the band, okay? So I'm standing, I'm holding the same band, standing on it, I have my hand beside me, and this is shoulder flexion. I'm going straight up. You can do thumbs up or neutral. We might even do thumbs down, but for this one, I'm gonna do thumbs up. When you're doing that, just find whichever one's comfortable for you. It works different muscles with your thumb up, neutral, or down, okay? With it down, it's called an empty can. The next thing is abduction, coming out to the side. Again, you can do thumbs up or neutral here, whichever one's the most comfortable. shoulder abduction. Okay, perfect. The next thing I'm gonna do is, I'm gonna stay standing on it. I'm gonna show you, this is pronation. So turning my wrist down. So you see how the band is on my fist on the outside. I would normally have my hand down probably, or may even have it propped up on something, but just for the video, forearm pronation. And then I'll let it come over my thumb and forearm supination. It's actually kind of hard. Okay. And then also we can do a bicep curl. Again, I'm still standing on this, coming up. You can do a hammer curl with your thumbs up. My elbow staying at my side, and I'm just curling up. Okay. The next thing we're gonna do is called horizontal abduction, pulling out like this. So again, I have the band in my hands like this. You can do it palms up or palms down. I like to do it palms down. Again, works the muscles a little bit differently. So we're pulling out here and back. Squeeze your shoulder blades and back in. Another one I really like is horizontal abduction or external rotation. So I'm here and I'm making a W with my hands. So I usually call this shoulder W's. So here and here. Again, you'll feel this in your shoulder blades. You can squeeze your shoulder blades together, just like that. Okay, so try those out, see if that helps with your rotator cuff, with your shoulder strengthening. There was a couple of forearm, elbow exercises in there as well. Try those out, let me know if they help. If you do these exercises for 3 to 4 weeks, 2 or 3 times a week, you should feel a big difference in your shoulder strength and shoulder pain that you might be having. All right, thanks.